With 2.5 million lives lost globally, including 672,000 children in 2019, pneumonia is the single biggest infectious killer of adults and children. With COVID-19 complicating things this year, experts expect the death toll from pneumonia to increase by 1.9 million. Statistics like these is why November 12 every year is set aside to promote interventions in protecting against, preventing, and treating pneumonia. Now, back in Nigeria, children make up the highest number of those who die from pneumonia, with an estimated 162,000 deaths in 2018. That is 443 deaths per day, or 18 every hour. It was the biggest killer of children under 5 in 2017. So, how can Nigeria tackle pneumonia to good effect? How can the mortality rate be reduced? Well, these are some of the questions our guests will be required to answer on Nigeria Today. Welcome to the program. I am Victor Azu. Now to discuss tackling pneumonia in Nigeria, I have been joined by Dr. Isah Adamu, Chief of Party Inspiring Project, Save the Children International Nigeria. Dr. Adamu, welcome to Nigeria Today.
Thank you so much and good evening to our viewers.
I'm also joined by Dr. Kingsley Usagi, Chief Consultant Pulmonologist, National Hospital Abuja. A pleasure to have you join us again.
Thank you very much. Good evening, Nigerians.
Now let me begin with Dr. Usagi. There's no better way to start than by asking, what is pneumonia and what are its symptoms?
Thank you very much. Pneumonia, simply put, is inflammation of the lung parenchyma. In the layman form, that is the fleshy part of the lungs. That is pneumonia. It's as simple as that. And the symptoms varies actually, depending on the type of organism that's involved, the age we are looking at, and of course if the patient has any comorbidities and all that stuff. But likely the symptoms include cough. Basically that's cough, and the cough most of the time is productive of sputum. For lobar pneumonia, even the sputum is characteristic. You see it's rusty brown sputum. But of course there are other forms of pneumonia, and then of course following that is chest pain, fever. You know, the fever for pneumonia is particularly high. You know, although for some atypical pneumonia like caused by tuberculosis and other, you can see low grade, but generally fevers in pneumonia is usually very high. And of course you have general body pains, loss of appetite, constitutional symptoms. But for children, you may be looking out for all this and you can still miss it out, but what parents must look out for is a child that has been running up and down and you see that it's not refusing feed, and of course it's having a temperature, and you see you observe the breathing of the child, that the chest, you see that instead of going out, it's now going in. We call it indrawing. That child may be having pneumonia. So it's very important we note some of these things, depending on the age group. No, and of course, it can present very mildly. So somebody has pneumonia, as people walking about, and also of course can prevent in a very moderate form or severe form or life-threatening form. Of course, the coloration that the current pandemic has put into it, COVID-19, and that, of course, for your intro, you alluded to the fact that COVID-19 pandemic is almost going to add about 2 million, deaths this year. So, of course, that's the estimate.
All right. Let me stay with you, Dr. Usagi. I'm not done. The statistics are mind-boggling, yet pneumonia is supposed to be preventable and treatable. How so?
Right. In fact, that is why I really thank the World Health Organization for setting out is a day like this to throw light on pneumonia, because if you know the causes of pneumonia, and of course you know how you can contract pneumonia, you may be able to avoid it. So we must emphasize it, and of course those that if you cannot avoid and you have it, and be able to go for treatment, and having it at the back of your mind that pneumonia is a treatable disease. So what am I saying in essence? The deaths that we are all seeing are all preventable deaths, and so we need to have informed, take informed decisions to be able to protect our children and even the adults, and so of course so that we can now and of course we are already practicing some of them, and COVID-19 has brought us up, apart from the medical one of using vaccines. Like we have pneumococcal vaccines available, you have influenza vaccine available, so we should take advantage of it. And of course, the no medical vaccine, the social distancing, the wearing of a face mask, the hand washing, and all that we are not practicing. It's also will contribute. Of course, good nutrition, very good environment, is very important because if you don't come in contact with the causative organism of this disease, you definitely not have it.
All right, we'll come back to what COVID-19 has done to make the situation worse. Thank you very much, Dr. Usagi, for your opening shots. And let me get to Dr. Adamu now. Given the devastation that pneumonia is capable of pulling off by the records, what are the common risk factors? Dr. Adamu, there seems to be a lot of misinformation out there.
Yeah. So thank you for that very important question, because if we are able to understand those risk factors, it will help us a lot in preventing or kind of minimizing the severity of the infection itself. Especially in the case of children, there is clear connection between malnutrition and pneumonia, and immunization status and pneumonia. These two factors are very, very critical. If we consider them as veritable predisposing factors and we do something to address them, it is really important. There are other conditions that could kind of suppress the immunity of a child. For example, if a child has a condition like a sickle cell anemia, and some of them, especially those in the villages, as I mentioned, they are so malnourished and their situation is ab initio bad, and you hardly find time to recover. Of course, in recent times, we even consider the environment where we live, the issues of indoor pollution. These are also so important. If we also understand these risk factors, it will be very useful for us. There are another group of children, the neonates, for example. When you look at their situation, those who come like with low birth weight, those who come with other conditions like neonatal asphyxia, and a few other conditions that are infection, sepsis, many of them. So once we catch them early, it is easier to kind of prevent the disease from happening, or kind of prevent or minimize the severity of the symptoms.
Now, how then can pneumonia be prevented, given all you have enumerated at now?
So, and I have to digress a little bit. There is one thing which we have not yet talked about, and I have to quote one senior executive of Save the Children called Mr. Kevin Watkins. He's the Chief Executive Officer of Save the Children. In the last editorial he wrote in The Lancet, he called pneumonia a cause without a champion. There is so much poor understanding of the magnitude of this pneumonia. A lot of people, beginning from the caregivers, that is the mothers, the parents, up to even some healthcare professionals, and then to policymakers, we don't seem to really appreciate the magnitude or the role that pneumonia is playing in under 5 mortality, not just in Nigeria but across the world. So one of the first steps of what you need to do if you want to prevent this, you have to raise awareness to start with. You have to let people know that this is a big problem. Because ask majority of people what kills children most, they'll tell you malaria. Some will even say meningitis. Some will say other things. But
I bet these days they will say COVID-19.
Yes, but if you look at statistics, whether it is from WHO, whether it's from UNICEF, whether from the Global Health Observatory, or from everywhere, just like in Nigeria and across the world, this pneumonia is the largest contributor to under 5 mortality. Unfortunately, a lot of us don't know about this, and pneumonia does not have champions. Just ask yourself, how many champions are there for malaria? How many champions are there for TB? And those for, let's say, polio even. You know, there are a lot of people that associate themselves with those disease entities, but not pneumonia. I don't really know who is a well-known personality in this country that is standing for children that are having pneumonia. So we have to raise that awareness. Let pneumonia occupy its rightful place. If we get that done, that is easier for us now to have partners in progress. I think that is one key thing we have not been talking about.
All right. Thank you very much indeed, Dr. Isah Adamu. But I'm still curious though, Dr. Usagi, is pneumonia a viral or bacterial infection? Is it communicable, for instance? How does it kill so much?
Yeah, okay. You're trying to find out the causes of pneumonia. Pneumonia can be caused by bacteria, can also be caused by viruses, fungi. And of course, these days we have seen parasites even forming it. For bacteria, commonest amongst is what called strep pneumonia. It's a very common cause of pneumonia, and followed by that you have Haemophilus influenza. You have Mycoplasma, Legionella, Klebsiella. There's so many that you can go down. Even though TB can also form kind of a typical pneumonia. Then of course, you see fungi, as you can have things like aspergillosis, things like even Candida albicans will be found to be associated with pneumonia, and of course viruses. We have chickenpox, pneumonia, all sorts of pneumonia. Of course, I would not forget to mention COVID-19, which is which kind of manifests as atypical pneumonia. Okay. You understand? So there are so many causes.
I know that a lot of people before now would say, well, cold. A lot of people talk about cold, but I've not heard that talked about much in this conversation. There's still so much to talk about. But let's pause for a break in the meantime and get the input of Nigerians on the streets. Nigeria Today returns afterwards.
At times, people thought it's only cold that causes pneumonia. It's not only cold. A very tough environment, when the environment is tough, it causes pneumonia. When somebody is overheated, you are sweating, and you do not wash it off or remove your clothes, and the sweat dries up in you, it causes pneumonia.
Okay, I think some of the causes of pneumonia has to do with harsh weather condition because of the intensity of the heat, due to solar radiation, because of the depletion of the ozone layer.
Dust can cause pneumonia. If your window blind is dusty, it can cause pneumonia.
I don't really know much about pneumonia because I'm not a medical practitioner, but the little I know about it is that it's caused by cold weather. It's a situation whereby somebody is feeling cold from the inside.
Exposing yourself in cold, it causes pneumonia. Also, most of the times, many people constant staying on AC, it causes pneumonia. There are people that their system accept AC, and there are people that system will not accept it. So most of the times, I advise people as we are approaching this dry season, people should also make sure they cover themselves up.
Welcome back. If you've just tuned in, It's about time. The program is Nigeria Today, and we are discussing tackling pneumonia in Nigeria. Interesting perspectives there, but does it suggest that there is sufficient information on pneumonia out there in the public? Dr. Adamu, you alluded to it earlier.
Yeah, you can see from what people are talking about, there is really poor understanding. And sometimes you don't blame people because not everybody is a medical personnel. Not everybody understand the difference between upper respiratory tract infections and lower respiratory tract infections.
Indeed.
Yes, we want to associate every cold with pneumonia or every dust with pneumonia. This is something that we have to do as health professionals at all levels to try to let people know that there is some little difference between a common cold and the pneumonia we're talking about today.
All right, and now 1.9 million more people may die or may have died because the year is coming to an end, and COVID has been with us.
Pandemic.
And COVID has been with us the whole year.
There's an estimation. We
Now,
will not get
but
there.
this year, because of COVID-19, like we said, but what could have been done to prevent most of it, Dr. Usagi?
Well, my colleague here has actually mentioned a lot about awareness, creating awareness. Yes, if we increase awareness among our people, fine. Then apart from this awareness, we have to organize our environment better, because if we are living in a crowded environment, and then you expect to, it's going to be difficult to prevent pneumonia from coming up. And of course, if you have underlying diseases, and of course you are going to expose yourself to these causative organisms, you definitely will come down pneumonia. And of course, we have to take advantage of the availability of vaccines.
Indeed.
We have pneumococcal vaccines now for all ages, not only children, even adults have pneumococcal vaccines now. So there's no excuse. So you can just go and have a shot, and of course that would reduce, even if you eventually have the disease, the manifestation will not be as bad as it would have been if you didn't have pneumonia. Of course, we also have to improve our nutrition. Proper hydration. We're just entering Harmattan season now. A lot of us would not remember to drink water. You understand? And of course, once you that, you are also, if your body is not well hydrated, your defense system will also be affected. Very good nutrition. Of course, a lot of us don't even rest. From here, we're moving to here and there, and of course that will increase our chances of coming across these causative organisms. Of course, then government has a role. Because, like my friend said, if you don't have a voice, you don't have a voice for it, you must have policies. That's okay, fine. And of course, let me say that the federal government of Nigeria has actually tried, because for children they have these vaccines available, but our parents taking advantage of this. That's the question I can't answer from here. But I can say that from this program that the vaccines are available. Parents, take your children for these vaccines so that we can at least prevent these preventable deaths that we are expecting.
I'm just wondering, when does it become necessary to get help for pneumonia, or perhaps require hospitalization, Dr. Adamu?
That depends on the severity of the case you have at hand. And as my colleague here said, the underlying situation you see. If you know somebody of initio is having some immunocompromised conditions, once you see pneumonia, you wouldn't joke with that. When you see children with this situation, the severity of the symptoms he mentioned, that chest indrawing. And again, I want to digress a little bit. In the program that I'm currently running in 2 states in Nigeria, Lagos and Jigawa states, that is supported by the GSK, we have just done assessment of 60 healthcare facilities in the 2 states. Most of them are primary health centers. And we have seen these same issues we're talking about, and we realize there is very, very residual knowledge about this diagnosis of pneumonia, the early diagnosis and either treatment or referral to a higher healthcare facility. I would tell you that the simplest devices, like a tiny device they call the pulse oximeter, which they wrap around the finger of a child to detect the level of oxygen in the blood, those things are simply not available. And if you go to some other hospitals, even if they're available, you see like 1 or 2 for the whole hospital. And then the big issue of oxygen, I have seen a lot of cases that require oxygen, and sadly most hospitals don't have this kind of facilities to support this kind of patients. So as a program, we have been trying our best to see how we could arrange or address those issues. Right.
All right, let's bring it back home, Dr. Usagi. How can Nigeria reduce the mortality rate due to pneumonia?
Thank you very much. Of course, we start addressing it even from, antenatal to birth to the elderly. Of course, immunization I've mentioned, breastfeeding, for the babies, adequate hydration, of course, good nutrition for the baby, and the environment, very well ventilated environment, of course, once we have that, we will be able to reduce this. And of course, we must educate the parents, because if the mother is well aware of some of these things, early detection of the disease is another key thing. And of course, availability of drugs to be able to treat these diseases. You must have drugs available, and of course our primary health centers must be up and running, so that of course it's not everybody that will come to the tertiary institution and all for. So our primary health centers must be up and running, and then the staff must know how to recognize a patient that has pneumonia.
Okay.
Understand?
Now, Dr. Adamu, you heard Dr. Usagi. He has talked about the importance of educating parents. Now, what should be, apart from parents now, what should be the role of government and society in curbing the menace that pneumonia has become?
Thank you so much for that question. It is really, really important, especially on this World Pneumonia Day. First of all, as gloomy as the statistic is, Nigerian government has done something which we have to commend. We have a national integrated pneumonia control strategy. This morning, the Honorable Minister of State for Health, Senator Mamora, actually disseminated that policy document. It is a framework, an implementation plan, which will be used across the country. There exists one group of committed development partners. It is called Every Breath Counts Coalition. In this coalition, there is UNICEF, there is WHO, there is Pediatric Association of Nigeria, there are pharmaceutical companies, Save the Children, many other NGOs. We put our heads together to produce this document, which provides clear guidance on what needs to be done to address pneumonia in Nigeria. This document is the first of this kind in this country, and we realize not many countries have this kind of strategy. We have it already as a policy framework. Our duty now is to disseminate it at state level. So if we have such a policy document, which has already been costed, we actually know now, have some idea how much we will require as a country to address key components of that pneumonia strategy. So it's something we have to commend Nigeria and everybody who has played a role in doing that.
All right, Dr. Isah Adamu, Chief of Party, Inspiring Project, Save the Children International, Nigeria. It's been a pleasure having you on Nigeria Today. Many thanks.
Thank you so much.
And Dr. Kingsley Usagi, Chief Consultant Pulmonologist, National Hospital, Abuja. Thanks for your time and thoughts.
Thank you very much.
And thanks for watching there. Nigeria Today returns at 7:30 tomorrow evening. But you can watch this and other editions of the program on www.youtube.com/NTA News 24 Hub. My name is Victor Azu. Join us again.